who's the first adopter, who's the first person who's going to lop off a perfectly fine arm and replace it with this bionic one.
We're starting to see healthcare move beyond the four walls of the hospital.
Just go over to your 3D printer and print out the drug that you need.
In 2050, I get customized medications tailored to my molecular genetic makeup.
How will the system bear these costs?
What it has done is it has brought the C word, cure, into the dialogue of cancer.
Welcome to the Future of X, a podcast from OZY that vaults you forward 50 years to the year 2069. We explore a world that's at times tantalizing, at times a little bit scary, whether it be the future of our cities, our schools, or even our sex lives. I'm your host, Carlos Watson, Editor-in-Chief of OZY. Our first season in partnership with Providence St. Joseph Health looks into something that touches us all, the future of health. In episode 1, we talked about the future of illness, how cancer is expected to become merely a chronic condition while loneliness could take its place as a fatal epidemic, and how personalized immunotherapy will revolutionize the way we treat ourselves. In today's episode, we talk about what that means for the role of healthcare workers, there are 18 million in the US alone, and how we'll pay for care in the future. Plus, will you be transhuman? Today, when you need urgent care, you go to the hospital to be treated by a doctor. For many, the process feels about as efficient as going to a well anytime you need water. And yet, in every other facet of your life, from online shopping to shared rides to late-night burgers, the thing that you need comes to you. In the future, experts predict that hospitals as we know them will be a thing of the past. Instead, AI bots at your home and in mobile units will fix you up faster than doctors and nurses ever could. And guess what? It'll be a whole lot cheaper too. And it gets even crazier. In 50 years, experts say that perfectly healthy people could opt to have their arms and legs replaced with bionic limbs. That's being transhuman. And to prevent disease, you might be able to edit your DNA completely on your own, as if you were dyeing your hair. Let's listen in on a scene from the year 2069 when everyday technology catches up with an urgent but all too common accident.
Ouch!
Hello, Maya. Please place your injury under the scanner.
Okay. Ugh.
It appears you have a deep laceration to your left index finger. You will need 4 per-string stitches. Please place the injured finger inside the machine as seen on the screen.
Oh, that feels much better. Please print pain relief.
Stand by. I will print out 10 400-milligram capsules of ibuprofen to help with the pain. Please take as directed.
Whew. Now, where was I?
A half cup of diced carrots, Maya.
In 2016, a college student in Pennsylvania named Matt Anderson was hit with a bill for $2,782 after receiving liquid stitches at the emergency room. One reason the cost was high is because Anderson's visit was billed as 2 days, even though he was there for just 2 hours, from 11 p.m. to 1 a.m. Matt Anderson honestly could be any of us. These days, most non-emergency visits to the hospital are expensive and inefficient. A deep cut that requires stitches could cost you thousands of dollars in hospital bills, not to mention all the hours you spend waiting. According to the Healthcare Cost Institute, the average cost of an ER visit in the US is just under $2,000, which, if you don't have insurance, you might have to pay for out of pocket. But that could all change in the future as AI and machine learning makes medical care faster, cheaper, and mobile. Right now, the most advanced medical technology is still only available inside a hospital. But according to Amy Compton Phillips, Executive VP and Chief Clinical Officer at Providence St. Joseph Health, operating rooms of the future could change dramatically. In fact, they may not be rooms at all.
I could easily see a time where we have ORs that move around on flatbed trucks and come in twice a week to a rural community to do whatever they need, as we aggregate services.
In the future, the care will come to us instead of the other way around. There may be little need to visit a hospital or pharmacy at all, because we could all have 3D printers at home. 3D printing is already used to make everything from shoes and car parts to blood vessels and guns. And now, researchers are tailoring these printers to synthesize pharmaceuticals and other chemicals from simple, widely available starting compounds. While it remains to be seen whether drug regulators will go along with the new way of making medicines, Compton Phillips likens this progress to something we're all familiar with: online shopping.
I think believing that most of healthcare is going to stay in large, capital-intensive brick-and-mortar businesses is not a sustainable picture for the future.
Speaking of capital, let's talk about how this directly affects costs.
This is an incredibly large and, generally speaking, inefficient industry in terms of how we deliver care and how we pay for care.
This is Jorge Conde, general partner at the Silicon Valley venture capital firm Andreessen Horowitz, who specializes in investing in healthcare and biotech.
So I think one of the key things that we will increasingly see over the coming decades is that as you introduce into technology into the healthcare industry, it'll really shift the way care is delivered.
A study by the Journal of the American Geriatric Society found that elderly patients who received house calls over 2 years spent nearly $8,500 less on healthcare on average compared to those who received no house calls at all.
A study out today found homestays have the same levels of safety and quality of care as those in the hospital, and at about half the cost. Doctors ordered far fewer blood tests and scans.
But a lot of new technologies in treatment, like immunotherapy, which we heard about in episode 1, are prohibitively expensive. Conde has an interesting idea about how we're going to pay for them.
Even if the cost of therapy is on the order of millions of dollars for these one-and-done treatments, the payment schema don't necessarily have to be paid up front. So there are various things that are, various approaches that are being explored actively to figure out how to shift increasingly to value-based payments, and also time-delayed payments if things are going to have benefits over a lifetime.
In other words, mobile or at-home care actually saves us money. But when we talk about a future where at-home medicine is the norm, what about the 500,000 people across America who are homeless?
And in some cases, the most vulnerable, the ones who have the greatest risk of having a health concern, don't live in homes that would be conducive for care.
Carla Denise Edwards, Executive VP and Chief Strategy Officer at PSJH, warns of the risk that at-home care could harm a section of the population that's already in dire straits.
For others, there's still going to be a need for them to be treated in a setting that's safe, that's clean, that's comfortable, that enables them to get the full plethora of services that are needed, not just to be treated, but to heal.
There's always hospitals will be around to do the more intense medical procedures.
This is the CFO of PSJH, Venkat Pamidapati. He worked for 13 years at Microsoft, and his tech background means he's familiar with disruption. And it's no secret the healthcare industry is beyond ready for a shakeup.
I'm personally pretty stunned about how much of expense is in non-clinical areas. The sum total of that, frankly, is almost $500 billion. Everything from registering a patient to providing the service to following with the insurance companies on getting paid and following up with the consumers. So all this is literally, in my opinion, pretty antiquated. This is ripe for automation. So using technologies such as blockchain, which are immutable and have a distributed ledger, I think we can reduce the human intervention dramatically.
And there it is in 3 words, an all too true future for industries far and wide. Reduce human intervention. But as tech rapidly advances and machines replace humans across a wide array of industries, where do doctors and nurses fit into the future? Amy Compton Phillips again.
I do believe that there is something intrinsic in the human nature of healing.
I expect health sensors to be on my body, even digital tattoos that I don't have to bother using, but I know they are there, measuring data, and when there is something wrong, these technologies let us know.
That's the vision of the future, according to Dr. Bertalan Meshko. Dr. Meshko created the Medical Futurist Institute in Budapest to understand how digital health technology will reshape medicine. Today, by the time you feel a stomachache or a sore back, the illness has already been working its way through your body. But a digital tattoo, as Dr. Meshko describes, worn on your arm and outfitted with tiny electronic sensors, could constantly measure your blood pressure or hydration level in the background and send a message to your phone if something seems out of whack.
In 2050, I get customized medications tailored to my molecular genetic makeup, tailored to my lifestyle, 3D printed on demand, on site.
You could have a diagnosis and customized treatment plan days earlier than what's currently possible. Or we could take it one step further. In the future, brain implants could improve our memory and exoskeletons could even boost our strength. If you could replace your regular old arm with a robotic arm, would you?
And next up, we have this beautiful reclaimed graphene bionic arm from designer Arms for You. It has all the features of the newest model, including rapid vegetable chopping, trash compacting, and the ability to administer stitches or heal broken bones in virtually any part of your body. This bionic arm has all the deluxe features, and the exterior is made of reclaimed graphene, giving it that Brooklyn hipster coffee shop vibe, circa 2018. So retro! And it can be all yours for the low price of just 1 Ethereum per month. Yes, seriously, folks, act now. It won't cost you an arm and a leg. Or maybe it will. Reclaimed graphene bionic arm is not an Earth-made product and may carry various unknown specimens due to interspace travel. Do not eat.
It's completely conceivable that in the not-too-distant future, permanent, fully integrated prosthetic limbs and bionic implants will be widespread. The future of healthcare is not just going to be about being healthy. It's also going to be about improving or upgrading ourselves, perhaps at all costs.
Some of us will be transhumans. We'll have bionic arms that stitch our wounds or do way more mundane things like chop a ton of vegetables really fast and fold laundry. Here's Jay Burkholder, the general manager of New Hampshire-based Mobius Bionics, which specializes in developing robotic medical devices.
We've received credible requests for people to be able to remove a perfectly good arm and put a Luke arm in its place because they're just so excited about the possibilities of the technology.
A Luke arm is a commercially sold prosthetic arm that includes a shoulder and 10 powered joints. It has multiple grip patterns and can vibrate to give the wearer the sensation of touch. Its stamina at taking on tough or repetitive tasks would be unparalleled by anything human.
The capabilities of prosthetic limbs are going to get better than or more sophisticated than the human capabilities. So there's 2 questions here. Well, one, who's the first adopter? Who's the first person who's going to lop off a perfectly fine arm and replace it with this bionic one? The other thing has to do with the regulatory aspects of it. You know, I can't sell an arm to replace a perfectly good arm, and I expect that FDA is not going to be interested in supporting that for some period of time.
Even though I'm not volunteering to have either one of my arms replaced anytime soon, I'm sure there'll be plenty of people ready to go bionic once regulation is in place. Think about all of the sports-crazed parents who had big dreams of playing in the NFL and are now looking for any way to make their kid the next Tom Brady. Before we become part machines ourselves, we will increasingly rely on AI and other technology to work alongside us. In fact, AI is already saving lives today. In 2016, a 60-year-old woman in Tokyo was diagnosed with acute myeloid leukemia. She was treated with anti-cancer drugs but didn't get better. Then, her team of doctors at the University of Tokyo's Institute of Medical Service analyzed her health data using Watson, IBM's cloud-based computer system that has ingested tens of millions of oncology papers and data from international research institutes. And just for the record, me and Watson, we're not related. At least not that we know.
The analytical machine took just 10 minutes to compare the patient's genetic changes with a database of 20 million cancer research papers, delivering an accurate diagnosis and leading to proper treatment that had proven elusive.
While software engineers and geek squads will undeniably play a large part in our at-home care, some parts of medicine are still too complicated to rely on automation completely. At Johns Hopkins University, their soft tissue autonomous robot was able to perform open surgery on a pig completely on its own. But the robot took 6 times longer than a human typically would and made more mistakes. At best, AI and machine learning will support doctors and nurses, and the perfect illustration of this? Compton Phillips says the future will look a bit like the USS Enterprise.
What does Star Trek show? Right? Bones is a character, that there always is a doctor, even though that doctor and that nurse are enabled by different technologies and different tools of today, there still is this human interface to go between the technology and the human being who needs care.
One thing is clear though, technology can help physicians become better caregivers. In 2014, a Senate hearing on patient safety found that medical errors were the 3rd most common cause of death for people in the United States, only behind heart disease and cancer. And a study on using deep learning to diagnose metastatic breast cancer found that when predictions from human doctors were combined with machine learning, the human error rate fell by 85%.
We want people to be their own hope.
Meet Josiah Zahner. He runs the OZY, a consumer genetic engineering startup in Oakland, California. Before starting the OZY, Zahner worked at NASA. He decided to launch his company to teach people how to use techniques like CRISPR, a tool for editing genomes to prevent and treat disease.
A lot of times in this world, the system lets you down. Whether it's the medical system, the educational system, the scientific system, it lets you down. People aren't willing to do research on your disease because there's no money in it. A lot of times your only option is yourself and your loved ones.
So what exactly can you do with an at-home genetic engineering kit?
Our kits, most of them are educational regarding CRISPR and other things, but we don't necessarily sell the tools for somebody to genetically modify themselves. We try to teach them and lead them through that process so they understand how it works and could do it if they needed to.
This is not happening yet, but we're not far off from editing our own genes to stave off disease, and probably seeing quite a few mishaps and ethical dilemmas along the way. Anyone who's tried to dye their own hair at home knows that it's often worth the money to do it professionally. Now imagine you had the tools to alter not just your hair, but your entire body.
I always ask people, what's the worst thing that could happen? As much as we love to talk about zombie apocalypses and eugenics, none of that stuff is really real. It's not in the realm of reality. These things, even if something bad did happen, it would be easy to stop, easy to isolate, easy to prevent. These things won't affect wide swaths of populations because, in general, genetic modification of adults, isn't passed on to the children.
It may seem like a long legal and ethical jump from DIY stitches to DIY genetics, but just as people once had to go to the well to get water, it's not hard to imagine a future where these on-demand at-home services will become the norm. Thank you for joining us on The Future of X. This series is a partnership between OZY and Providence St. Joseph Health. On the next episode of The Future of X Health, what happens when a distinguishing characteristic of your brain that was thought to be negative actually turns into an asset? We'll learn how people will harness mental illness traits like hypomania to boost their productivity, how brain implants will anticipate the onset of depression and prevent it from taking hold, and how you may borrow serotonin from your neighbor as easily as you would a cup of sugar. The Future of X is produced by OZY in partnership with Providence St. Joseph Health. I'm your host, Carlos Watson. Leah Rose is our producer. Molly Fosco and Sean Braswell are the editorial producers. The show was edited and mixed by Chris Kim. Rob Kulos is our executive producer, and Faye Schlesinger serves as managing editor. For more on The Future of X, go to ozy.com/future. That's ozy.com/future.